Hi, I'd like to talk about the difference between the types of administration of testosterone. Many of you know that testosterone is commonly used in men and in women for symptoms of low T, and I've talked about that in other videos. But today I would like to talk about the different applications of testosterone for men. I'm sure many of you have heard that testosterone comes in a cream or gel form, it comes in an injectable form, and it comes in pellets. Well, all of them have advantages and all of them have disadvantages. My favorite form happens to be pellets. Pellet therapy is very nice because it provides a nice, constant, steady stream of testosterone into the body. And in fact, it's almost like testosterone on demand. When your heart rate goes up, the amount of testosterone released into your body goes up. So it almost auto-adjusts. So when you're exercising at the gym, when you're running or jogging, when you're bicycling, or even when you're under stress, your heart rate will go up, the blood flow goes over the pellets, and it increases slightly the amount of testosterone in your body, meeting your body's demands at that time. It's also very easy. Pellets are given once every 4 to 5 months for men for a very small, tiny incision in the buttocks. The pellets are put under the skin and they're left there to do their job over the course of time. The side effects are minuscule. On rare occasion, there will be a rejection of one of the pellets, and on extremely rare occasion, far less than 1%, is there an infection. But overall, subcutaneous pellets, pellet therapy for testosterone is very safe and very effective. Well, how does that compare to the creams or the gels? Well, the gels can be a real problem. While a lot of men are out there using them and getting a very good result with creams and gels, the fact of the matter is gels can rub off on family members, on pets, on children, on friends, on just about anybody or anything that comes in contact with you. And when that happens, these people can get unwitting side effects from the testosterone that you're using. It's kind of funny the way the story goes, and a very famous international hormone specialist from Belgium likes to tell the story of how he says, well, it's kind of cool in the beginning because when your wife gets that testosterone that's rubbing off, well, you're getting sex pretty much every day. Well, then after about another month when she's growing a full beard, well, then you don't want sex with her. So, the problem of what we call transference can be a big deal with testosterone, and it's one of the major disadvantages with creams and gels. The other disadvantage is it's very difficult to tell whether or not you're getting a proper level. Transdermal creams and gels are very difficult to measure with blood levels and often have to be measured with saliva. Saliva can be very effective. Some people just don't like spitting in the tube. Some people don't like dealing with it. And then the other problem with the gels and the creams is that they have to be put on every day, sometimes twice a day in order to get the best effect. So while some men do very well on creams and gels, and I use them in my practice too for appropriate individuals, it is important to understand that they have to be used with care, and they can cause problems for people around you. Finally, I'd like to talk injections. Injections are another form of administration for testosterone. They're very common. Testosterone comes in a number of different forms of varying long-lasting duration, depending upon the molecule that's attached to the testosterone. Some use cypionate, some use enanthanate, and there are other more long-acting forms of these testosterone esters, as they're called. And what happens then is that testosterone is injected into the body, and it can be twice a week, or I've seen people do it once a month. Okay, that testosterone then has to go to the liver. That ester has to be cleaved off in order for the testosterone to be activated. So it depends upon a healthy liver in order to get that done. That's usually not a problem for most people, but these days we're seeing more and more liver disease, and fatty liver is becoming a bigger and bigger problem in the United States. The other problem with testosterone injection is there has been some reports that those side chains, those side esters used over the long term can cause some problems possibly in the liver. So that's something to think about if you're thinking about being on testosterone long term. And again, while I use injection in my office all of the time, I am cautious of this, and I do understand that it is a problem. The third problem with injections is that they have to be given, and a lot of people just don't like taking needles. That may cause people to take them only once every 2 weeks or so, or even as much as once a month. And while there are some very long-acting injections You still do have the problem with peaks that come up early in the course of the injection. They tend to go up for a while, and then they tend to go down and crash. They go up and then they crash. Well, it's kind of like a roller coaster ride. And when I get my testosterone, I want it even. I want it nice and smooth and level over the course of time. And that happens best with the pellets. Again, creams and gels are good, injections are a good vehicle, they all have their limitations, but in my opinion, the pellets are a nice, smooth, even form of delivery for testosterone for men.